I have done agency shifts in some units and I'm like,
oh my god, can this day just end?
nursing remains one of the most noble profession in the world. It remains one of the best profession that is sought after by a lot of people in today's generation. But your specialty in nursing can make you or it can break you. In today's video, I am going to be telling you how to choose your nursing specialty. My name is Deo Goodness and I am your captain. If you are seeing my face for the first time, welcome to my channel. I hope you do not make it your last by subscribing to my channel, hitting the like button, and also turn on your post notification bell so that you do not miss any of my future uploads. Now, a bit of background about me if you are not so much familiar with my nursing journey. I am a registered nurse currently practicing here in the UK. Ever since qualifying, I've worked in home care, and then after a while I switched over to care home nursing, and then I switched over to medical wards where I worked in the cardiology ward. And then after 2 years I moved to anesthetics, which I'm currently doing. So I've been a bit of everywhere, and currently I still do agency shifts in surgical wards, in medical wards, and so I have a bit of idea on most specialties. That's why I feel the need to give you some advice on how you can choose a specialty that will be better for you. The first thing I want you to focus on is ask yourself some questions. What is my passion? Okay, so yes, nursing as a whole is a profession that you need to have passion, you need to be compassionate, you need to be this and that, but as a person, what is your passion? Okay, do you like aged care nursing? Do you have passion for children? Do you have passion for the young people? Do you have passion for people with mental health condition? What is your passion? So when you answer that question, that will give you a guide on the range of people you would want to work with. Okay, and then the next question is, what is my personality? Okay, see, I know that nursing has loads and loads of specialties. That's one thing I'm grateful for. As a human being, there will always be one nursing specialty that will fit you the most. But what is your own personality? Okay, there are some people that are very jovial. Okay, so as a nurse you need to be jovial, but there are some people that are extremely jovial. Those people will be better off in the pediatric ward, if you ask me, or in the elderly ward, because the elderly people kind of behave like kids as well. So either you go to the elderly ward or you go to the pediatrics. So these are things you need to know. What's your personality? Are you a strict person? Are you someone that loves to get things done quickly? You might love to work in the emergency room. Are you someone that likes to think critically? You don't like being rushed. You might love ITU, because ITU is more of critical thinking and all that, although you have to work with time, but it's more of critical thinking as well, not just rush to do something wrong. If you love a slow-paced area, you might love it in the wards, like ward settings, in rehab centers and all that. So you have to think about your own personality. Are you slow? Are you fast-paced? That will help you, guide you as well, what specialty to choose. Now, we've talked about two. The next thing you want to consider before choosing a nursing specialty: availability of jobs. Now, I know with nursing, you will never lack jobs and all that, but guys, let me shock you. There are some specialties that it's going to be hard getting a job. Okay, it's going to be hard getting a job, and that is just the truth. Now, take for example, when I started my anesthetic program, there were only about 6 of us that were taken for this particular job, and that's because we had to go through a training and all. But if you want to go into the medical world, it's going to be easier for you rather than going to anesthetics. So what I'm trying to say is, what are the availability of jobs? It depends on what country you are currently as well, because I know that in the UK there are not a lot of roles for anesthetic nurses as compared to other countries. We have the ODPs here in the UK. These are operating department practitioners. They go through university and they get their own degree. I know previously it was diploma, but now it's degree, so it's like 3 years. They have almost same scope of practice. not really like exactly what nurses do, that what they do, but they have scope of practice that would or enable them assist their anesthetists in the theater. Okay, so because of that, they don't really get registered nurses to act as anesthetic nurses, because you cannot just work in an anesthetic department without having a formal training, and that means there are not lots of jobs for anesthetic nurses compared to other countries. I'm aware of some of my friends who are trying to get into the role, but their hospital do not have that role. So you have to look at your environment. The specialty I want, is it readily available? If it's not, are you willing to move? If you're not willing to move, then you might as well look for another specialty that is readily available. Another point you need to take note of before you choose your nursing specialty is the career progression. Now, guys, this is like one of the most important things you have to think about, because we as humans, we need to grow, right? So if you go to a specialty that the career progression is very, very limited, you might not like it, and you find yourself not liking your profession. Meanwhile, you are the one in the wrong specialty. So you need to think about the career progression. Is there career progression? Where am I going in the next 2-3 years? If I'm going to move up, like in the UK, we have banding system. The next band, is it a management role? Are you willing to take up management role? Do you love management roles? Are you a leader? And if it's not a management role, if it's a clinical senior roles, are you willing to go back to school to get a master's? Because most clinical roles that are senior roles, you need to go back to get a master's. Some of them will say go, and so you need to go back to school to get a master's degree. So are you willing to sacrifice your time to go back to school? You need to think about all these things before you choose your own specialty, okay? So not just choose, because at the end of the day, that's why some people have been in the UK for 10 years, 20 years, and they are still at band 5. And that's because when you ask them, they'll be like, oh, I don't want to be a manager. And you are in the ward. You are in a ward setting, probably in the elderly care unit, where the only career progression in elderly care unit is either you go to dementia specialist nurse, or you go to charge nurse and management role. With the dementia specialist nurses, in every hospital they only have a few of them. Like I think in my hospital we only have like 3. So you can imagine how competitive these specialist roles are. If you're in an environment that doesn't really allow for career progression in the aspect you want, it's going to be hard. But getting a band 6 in management role like charge nurse is quite easier than getting specialist roles. Even if you're going for a specialist senior role, how relevant would that be, like, for you in the wider perspective? You need to think about that as well. Will it be relevant? Like, I know some people that are heart failure specialist nurses and they love it so much, but I know some people that are stomach nurses that they feel like their job description is quite boring. So you need to think about that, the career progression. Would you enjoy that? Would you not enjoy that? Okay, so you need to take that into consideration again. The next point I would like to talk about is the money. Yes, guys, look, I know nursing is calling, nursing is great, nursing is this, not that, but we need to talk about money. Money is very important. How much do your specialty pay in the country you're currently living in? Okay, so every country has their pay for every specialty. In the UK, they have their pay. In the US, they have their pay. In Australia, they have their pay. In Canada, they have their pay. So you need to consider that as well. If you are a cardiac nurse, is your country of residency paying cardiac nurse as well? If you are not paying, are you happy with the pay? Because see, look, I know that money is important, but there are some people that are very, very content. And I'm not going to say, oh, you have to go for this one because there's money. No, but if you are content with your specialty salary, that's absolutely fine, okay? But if you're someone that is very, very concerned on how much your specialty pay, you want to look and search for the highest paying specialty and then pick which one that is of interest to you. I have a video about the top highest paid specialties here in the UK. I'll put a link in the description for you to watch and know which of them would interest you if money is a big deal for you, okay? So that's another thing to consider, like, what are the specialties that will pay me more? And for a case where you are in the UK where the NHS banding seems to be limited, you want to consider which specialty will pay you more as an agency nurse, okay, not just with the NHS. Because if you are concerned about money, you wouldn't be looking at just the NHS alone. You want to look at what private hospitals will pay. You want to look at what agency pays some specialties and look at the highest paying ones and then figure out which one will suit you. Another thing you have to consider before you choose your nursing specialty is what is the working schedule like for these specialties. Now, some specialties, there are no nights, there are no weekends, okay? You just have to work Monday to Friday, 9 to 5. Now, for a lot of people, 9 to 5 is not a thing. People do not like 9 to 5. Personally, for me, I do not like 9 to 5. I don't think I will ever do a job that is 9 to 5 because it is too limiting. I know the good thing is you know when you're working, you know when you're off, but it means I have to be at work 5 times every week, which for me, I'll still have to wake up early anyways. That means my whole day, even if I have to clock in at 9, it means I have to wake up by 6. And then my whole day is going already. And then when I come back by 5, I'm already tired, and that day is a waste. 5 days, and then I only have 2 days off. But so there are some specialties like outpatient clinics, they run 9 to 5. Some short stay units will run 9 to 5, and then you just have to figure out. However, if you want to work 3 times a week, long days, you need to look for those specialties as well. So most specialties here in the UK work long days. So most of the medical wards, most of the surgical wards, anesthetics, scrub nursing. And then that's one reason why I didn't go for endoscopy nursing, because they work Monday to Friday. Endoscopy units do not really have weekends or night except only emergency, and it is limiting. You just have to put that into consideration as well before you choose your nursing specialties, okay? And in a situation where you are in the UK, where if you don't work nights and you don't work weekends, your pay is less. You need to consider that. Very, very important, okay? So that's one thing you need to consider before choosing a nursing specialty. Another thing to consider before choosing your nursing specialty is the workload. Nursing itself is stressful, but there are some specialties that will stress you more. Stress you that even if you're at home, you'll still be feeling your back, you'll still be feeling your legs, or will I say you wouldn't even feel your legs? You wouldn't feel your legs. I think that's much better. You wouldn't feel your legs at all, okay? So I don't want to sound discriminating, but just go online and search for the workload before you choose your specialty. I have done agency shifts in some units, and I'm like, oh my god, can this day just end? Because it was really, really heavy. Patient load, you need to consider that as well. How many patients would you be taking care of in that unit? One reason why I love anesthetics, guys, it's gonna be looking like I'm telling all of you to come to anesthetic, is because I only have to look after one patient at a time. And that's same thing with ITU. Oh no, I think sometimes ITU they take care of 2 patients depending on the level of the patient. I think level 2 and level 1. Consider as well, how is the workload? Is it something you can do? And that brings me to my next point as well, which is how healthy are you? Okay, as much as we need to look after people, we need to look after ourselves as well. Now, if you are diabetic, you need to look out for wards that will let you go out for breaks. You need to look out for specialty that wouldn't require you to miss your lunch break, your breaks, because you need glucose, right? A specialty that will give you some time, like time for you to check your glucose level, time for you to give yourself insulin if you need time. There are some specialty that you will not even have a single second to yourself. So you have to consider that as well. If you are high risk, if you have any infection as well, you want to look out for specialties that will not let you to expose yourself to the patient, to cause harm to the patient or your work colleague. That is why we do occupational health tests to see what vaccines you've had and what illnesses you have, what infections you have. That is not to discriminate you, honestly. It's just to know if you're fit for the job, if you're fit for the specialty, because I work in anesthetics and I deal with blood, I deal with sharp object and all that. And if I have an infectious disease, it will mean that my patient is at high risk of receiving those things as well. It's not a nice thing for me to work in high risk area. So then I have to choose a specialty, maybe a specialty that will not require me to expose myself to the patient, or rather the patient to me, depending on the situation. Another important factor that you have to consider before choosing your specialties: are you an introvert or an extrovert? So this is very important. I know as nurses we need to talk, we need to communicate, we need to do this, we need to do that, but there's just some people that pass through nursing school and they are still not outspoken, and that is fine. Okay, there are lots of specialties that will fit you if you're not so much good with communication. You can go to mental health nursing, where you can be doing one-to-one to just one patient. You can even go to home care nursing, where you just have to communicate to one patient at a time. Those are the specialties you can look for. But if you are good with communication, like if you're an extrovert, you really love communication, you want to go to places that will let you communicate with people, like in the ward setting, you have to communicate all the time. In anesthetics, you have to communicate. In the wards, you have to communicate. So the discharge coordinator, all these are specialties that will allow you to communicate a lot. So you need to think about yourself. Are you an introvert or extrovert? That will help you choose a specialty. For ICU, you don't really talk that much because the patient will be able to communicate back. But if you're not the chatty type, you might still like ITU, although you still have to communicate to your patient regardless of if they are able to answer or not. But the fact that they can't answer, it helps if you're not the chatty type. Okay, so these are the things you need to consider before choosing your nursing specialties. I hope you loved this video enough to hit the like button and subscribe. Let me know in the comment section if this has helped you or this will help you, and I'm gonna see you in my next video.